So Bismillahirrahmanirrahim. So let's start. First case I'm going to discuss is knee ACL, meniscus injury, MCL injury, or you can take it in any way. Either it's a PCL injury, I mean overall any ligamentous injury. This case that I'm going to discuss, first I'll discuss the history, then the examination, and then the viva that can be asked. If you want to, if you see any interruption from of the screen of my voice, you can just leave a message and I will correct the thing. So let's start. If either it's going to be virtual or in person, this today's presentation will help you in both ways. How the case is started, how it is started, either it's a virtual exam or the real exam. So you will start it with hello or Assalamu alaikum. My name Dr. Irfan Ahmed. I am Dr. Irfan Ahmed, one of the exam candidates. I have been asked to ask few questions regarding your condition. Is that okay with you? The first part of the history is the biodata. So there are a couple of questions that you need to ask. First is, can I please confirm your name and age? What is your profession? What is your marital status? And how many children do you have? And where do you live? And what is your dominant hand? The dominancy of the hand is important in the upper limb. So I have still added it in it. So this is what about the biodata. So as you all know that we take the history in Urdu, but I'm still keeping the presentation in English so that different examination people can use it. So how you will narrate it after taking all this, I have mentioned it in the next paragraph. Then comes the presenting complaint. As I have told you that I am going to discuss the case of knee ligamentous injury, the presenting complaint will come. For example, he will say, give way of the right knee and painful click of the right knee for the 6 months and 4 months. You are taking the history, and what is going to be in your mind when you will talk to the examiner, it will be Aslam, 29 years of male, athlete by profession, married since 30 years, with 2 children, resident of Lahore, presented today with a complaint of giving way of the right knee for the last 6 months and painful clicking in the same knee for the last 4 months. So these 2.5 lines, they basically complete your biodata and the presenting complaint that you are going to tell your examiner. Then comes the history of presenting illness. History of presenting illness, it varies with case to case. Like what I am going to do now is dividing the portions, dividing case wise in the next edition of the book so that you can have an idea that case specific history of presenting illness is very important. Like if this ligamentous injury was due to some trauma or sports injury, then you need to inquire in detail along with the treatment taken for that condition. Like you will start, okay, the presenting complaint was giving way of the knee and the painful clicking. You will ask the next question, when did this all start? I have listed these 8 to 9 questions you can see on the screen. When did this all started? Were you able to get up after falling accident? You are asking these questions in Urdu. I mean, you will be asking, ये सब कब शुरू हुआ और जब आपको चोट लगी, आपका एक्सीडेंट हुआ, तो क्या आप खुद उठ सकते थे? Was there any open wound, bleeding, numbness, discoloration of the affected limb? So you will ask कि कोई खून निकला, कोई फटा हुआ जख्म तो नहीं था, आपकी टांग जो है उसमें कोई सुनपन तो नहीं हुआ था? Where were you taken after the fall? What initial treatment you get? What treatment you have got so far for this condition? Since when you are having give way in the knee? अब पिछले सारे questions जो हैं, they are regarding all the questions are regarding the trauma, the injury that made it, that made this injury. So all these questions are regarding this. The next questions are, now I am inquiring the first presenting complaint. Since when you have given way in the knee? This is the one of the presenting complaints of the patient. Which activity increase this? Any swelling with it? And when do you have clicking? Now the other presenting complaint. After going through all the trauma detail, now you have dissected the 2 presenting complaints. Now this is the sample. Look at the sample. that I have told you after biodata sample. This is the sample of history of presenting illness. If you can see, my patient was in usual, this is the sample that you will be telling the examiner. And the details you are seeing, you will see that these are a lot. But I think when you will speak, these are not that a lot, and examiner wants to know all. So, see the first paragraph. My patient was in usual state of health 6 months back when he had a sports injury while playing football and hit the other player, twisted his knee, fell on the floor, and he was unable to stand and was lifted by the other players. He developed sudden swelling in the knee. So every sentence in the history is giving a clue regarding what injury the player has got. He was unable to bear weight on the affected side, and there was no episode of unconsciousness, no open wound, no blood, and no numbness or any kind of discoloration. The next paragraph, what treatment he has taken. So the next paragraph is about that. And then the next paragraph, the third paragraph, is regarding he developed give way of the right knee since 6 months, and he feels that if his that as if his knee is about to give away, move forward, dislocate when he walks on uneven surface or climbs stairs, and then the other presenting complaint of locking. So till now we are working on the history. In the end of all this history, I will again show you the summary. History of presenting illness basically is divided into multiple parts. First part is you have asked all the questions about the trauma that made this history. You have dissected the presenting complaint of giving way and the locking. Now there is another paragraph that is about the disability. Are you able to walk without support? Are you able to run, jump, and climb up and down the stairs? Are you able to resume your sports activities? Are you able to use Indian toilet, public transport? Able to squat and get up, offer prayer, and able to personal hygiene, including changing your clothes. And as he is an athlete, you must also know, are you able to return back to your sports? So the next paragraph, which is the disability paragraph, that will consist of this paragraph. He is able to walk independently without difficulty on even surface, but he has difficulty on walking on uneven surface, running, jumping, climbing stairs up and down, and the main complaint of giving way and clicking. He has difficulty in using Indian toilet. So look at this paragraph, that in 5 lines how precisely this paragraph describes the disability. Then the history of presenting illness has not ended. First paragraph, you have dissected the history of trauma and his presenting complaints. Second paragraph, you have told about the disability history. Third paragraph, you are talking about the any morning stiffness. I mean, you're ruling out inflammatory arthropathies, ankylosing spondylitis, TB by these few questions. And the next paragraph will be no morning stiffness, no complaint of backache, redness of eye, burning micturition, or no history of night sweats. And do you have any chronic disease, any malignancy? And then you will quickly systemically review the questions of each system. And this line, he doesn't suffer from any chronic gastritis, respiratory, cardiac, and renal system, and doesn't have any chronic ailment. So here your present HOPI, history of presenting illness, is completed. Don't worry, who are joining late, I will summarize in the end. Past medical history and surgical history, very important. Are you on any medication? Have you been ever admitted for any condition in the hospital? Do you have any allergies? Have you been transfused blood, and what for any history of Hakim medication? Very important in our setup. And what will you get out of this paragraph, this 2 lines? He has never been admitted in the hospital, no drug allergies, no history of Hakim medication, and is currently on antihypertensive drugs or anything that the patient has. Coming on to personal history, these are the questions, and you should ask before. If you don't mind, can I ask some personal questions? Do you smoke, drink any form of drugs? regarding this question, you can ask if if it is something related to a condition that is linked to it. Does any other in the family suffer from the same problem? It is important in arthritis. And what are the most concerned? What are you most concerned about, and what is your demand? This question is very important, because in the end you should be able to narrate this to examiner. He's a non-smoker, non-alcoholic, and is most concerned about the locking and giving way, and he demands or expects early return to sports activity. So this is an important part of the history. Socio-economic history, a couple of questions regarding the income and the home. Where does he live? He owns a home, or he is on rent. The washroom status and other things, especially in hip and knee replacements. So this completes your history. If I go and show you the sample of the history, so you can have a look at the sample of the history. So look at this. This is the sample of the history that you are going to tell the examiner. See, although it still seems that it is quite a big page to narrate to the examiner, but when even 75 to 80% of this, if you narrate to the examiner, this will definitely give an impression to the examiner that you have a good grip on the topic. So this is the complete history summary. This first paragraph, Aslam, starting and ending at 4th month, this is about biodata and the presenting complaint. The next paragraph is HOPI, history of presenting illness, and it ends including this, his trauma history, his dissection of his presenting complaints, and then his disability, what things he is not able to do. This paragraph, he is able to walk independently without difficulty on uneven surface. And then comes the no morning stiffness, any ruling out any inflammatory arthropathy, TB, or any ankylosing spondylitis. And the last paragraph is systemic history. So this completes the HOPI, and the next paragraph is regarding his personal history, and then his past medical and surgical history. So this basically completes a comprehensive history. If you are able to tell the examiner 70 to 80% of this, then definitely you are going to have an edge and a good impression at the examiner. The next thing, so examination, I'm not going to in the detail of the examination. I have just written a sample of examination, because you can go through the examination in my book of Surviving Orthopedics. So if it is a examination of the knee, what examiner will expect? He will say, tell me the positive findings of examination. So this is a comprehensive summary and a sample summary. You should take this sample and practice, and then you will be able to narrate it yourself. I mean, this sample is not basically made that you just memorize and then go through. It's a sample. You should take it as a sample, and you should practice on keeping it as a draft. So see, on examination, general physical examination is unremarkable. Among the positive findings, examiner likes to hear the positive findings. He doesn't like to narrate examination from the start. See, quadriceps wasting on right side and 2 scar marks at the infralateral and inframedial aspect of the right knee when inspected from the front. So although I didn't discuss about in the history any arthroscopy, but just this is a sample, so you can have an idea that what type of examination summary can be produced. So he walks independently with visible antalgic pattern, and I have mentioned in brackets that if associated meniscal injury, or flex knee gait if the knee has flexion due to immobilization or stiffness, difficulty in squatting, sitting, cross legs, tenderness along the. Now see, this was all the inspection part. Now I have shifted to palpation, and I haven't said that on inspection this, on palpation this, because examiner doesn't like this. They like to give the positive finding. So tenderness along the right knee medial joint line. If MCL sprain, then add tenderness along its attachment, mild diffusion, positive swipe test, negative ballotment test. Some negative points needs, I mean, you are discussing the positive finding, but sometimes some negative points are needed to be described to differentiate. I mean, if you are talking about the swipe test, and then you have to tell the ballotment test, because ballotment test is for massive effusion and swipe test is for mild effusion. Wasting of quadriceps confirmed by measuring with tape, having 2 centimeter decreased bulk on the right side, comparable range of motion bilaterally 0 to 140 degree. Now I have talked about the range of motion, and now I'm talking about the muscle power. I have talked. Now coming on to the special test, valgus stress test, grade 1 positive. I am talking about the Lachman. I am talking in terms of grades. Examine, if you talk in terms of grades, that's a good impression that you know the basics of the test. So Lachman grade 3 positive with no bony endpoints. So bony endpoint, I mean hard and soft endpoints, we have to know the differences in between. And anterior drawer is positive, grade 3. Slocum test is positive, McMurray test is positive, and in the end, generalized like ligamentous laxity is not present. So this small paragraph is basically the complete examination. This is the way you should present your examination. So now the examiner, how the viva will take place. So here are the questions with the answers. So the first question of the examiner will be, can you briefly tell me the history of the patient? The history sample I have discussed, full 1 page, and you will be telling the history. Can you please tell me the positive findings of the examination? So examination summary I have already given, and this is enough for the examiner. So after listening to your history and examination, I am sure that if you follow this pattern, the examiner will be quite happy with you. And on the basis of your history and clinical examination, what is your differential diagnosis? So this is how your viva will go. Either it's a virtual exam or either it's a real patient exam. So on the basis of my history, clinical examination, my top differential are right knee ACL and medial meniscal injury, PCL with medial meniscal injury, ligamentous injury with osteochondral defect. So I know that you have done the clinical examination. You know that this is the your diagnosis, but you have to think a couple of more diagnoses to as a part of differential diagnosis. The next question will be, how do you reach at the diagnosis point in the favor of your diagnosis? Then you can tell that in the favor of the diagnosis regarding, I mean, you have to strengthen this answer with the mechanism of injury, the symptoms, the signs, and anything. I mean, you have to add all the spices in this question. Then I have added these couple of these 3 questions. I mean, more specific test of ACL, grading of Lachman, what is Godfrey's test. So remember one thing, the examiner may ask you the basics of different tests, and apart from the basics, he expect that you know how to perform the test. So how to perform the Lachman test? If he asks you, see, if you see what I have written, we all know how the Lachman test is performed, but we sometimes miss few things. Like, see, we have to feel the end point, and while performing the test, you should know that the following information: forward movement of tibia on the femur. What is the end point? Is it a soft or a firm? And what is the grade of anterior translation? And these are the grading of Lachman test. It is also mentioned in surviving orthopedic clinical exam. So what is Godfrey's test? It's an easy question. You can go, and this is one of the favorite questions of some examiners regarding pivot shift test. Many examiners I have seen, they like pivot shift test. Some can ask you about the basics. So how the viva will proceed further? So examiner will ask you, how will you proceed now? So you will say that on history and clinical examination, I have made this differential, but to confirm my findings and to confirm this, I will perform some radiological investigation. So be specific in your words. If you will say, radiographs of both knee. This doesn't make sense. You have to say standing radiographs of both knee and MRI of the knee. And one thing more, things change with the case. If you are having a case of MCL LCL injury, then you will definitely say for the stress views or stress radiographs of the knee. Examiner can ask that if you are going for the MRI, then why the radiographs? Although I believe that this is not a good question, but I have seen a couple of examiners asking this question. So that's why I have added this question along with the answer. The best answer is one, that the MRI is not dynamic, but in X-ray I can have the stress view dynamic views. Then the examiner will like you that you should be able to read the radiographs and the MRI. So they expect you to read the radiographs quickly and in sequential manner, but do not go too much detail that it is taken on 11th of blah. No, just talk quickly. Right knee weight bearing radiographs of Aslam, 55-year male, distal femur and proximal tibia among the positive findings. Quickly come to the positive findings. So I have written the answer, you can see on the screen. So this is the way how to describe the X-ray. Now uh, in sports, as this case is basically in the sports section, so you have to the examiner expects that you should know how to read an MRI. So regarding reading an MRI, candidate must be able to read the MRI of the knee in a systematic way, and I have a video on the YouTube as well. You can watch this if you want to. And I have added as well here that on the T2 images you should look for the coronal section, sagittal section, axial view, and what to see in the coronal section, in the sagittal section, and the axial section. Okay, after listening from you the MRI findings, the examiner will go, all right, so now after MRI you know that this gentleman has ACL tear, complete tear, and meniscal tear. How will you proceed? So either you are going to do the conservative or surgical method. Always add this line that I will discuss with my patient the treatment options, and then I will uh, give him the option of this and this. So he can ask that what method will you use to reconstruct. I mean, I know that in many centers arthroscopic ACL reconstruction is not being done, but now the things have changed. You should answer arthroscopic ACL reconstruction, but you should know the steps of both open and arthroscopic ACL reconstruction. Sorry, so what are the graft options for ACL reconstruction? So you can give a couple of options of this as well. And yes, now the examiner expects and you should know that what are the steps of graft harvesting. I have added this. You can also read from some operative book. So you should know how to harvest a hamstring graft, how to harvest a BTB graft, and if you know even one, that will be enough. But you should know a couple of, because sometimes the examiner can also ask, okay, this technique you were taking the graft technique has failed. So do you know any other technique? Okay. The next question can be, can you know the can you tell me the arthroscopy portals? Can you tell me about the steps of diagnostic arthroscopy? Can you briefly enumerate the surgical steps of the ACL reconstruction? You should know the whole procedure. You I mean, the preparation of clinical exam, viva exam is case to case. So you should have prepared all long cases in detail. Sorry. The next question, you have operated the patient, what will you do next morning? Many examiners like to know that after operation how much this candidate knows that how he will go and meet the patient. So this is that on the first post operative day I will start aggressive icing, immediate weight bearing, early full passive extension, and with the brace, and you should tell about the follow-up plan. So regarding the rehabilitation protocol, I know it's a bit difficult. I have added this picture from one of the operative books. either you I mean it's not easy to memorize full of this chart. So but I think that you should divide it into uh, keep the duration same, first 2 weeks, next 2 weeks, first second month, third month, fourth month, fifth month, sixth month, but just divide it into few things like range of motion, exercises, and aim. So in this way you should know some of these things. And at the end they do ask, like to ask, what is the recent advances. So recent advances, I don't know after 5 years, 10 years what things are going to be.